Hi, I'm Nurse Barb. I'm a women's health nurse practitioner, and this is your daily dose on a topic that's a little difficult to discuss, and that's vaginal pain. If you're having pain around your vagina or down there, it's very, very scary, and you may be wondering what's going on and what should I do? There's lots of reasons why a woman might have pain in her vagina, and I'm going to cover some of the most common ones. There's lots of reasons why there's vaginal pain. So let's talk a little bit about it. So number one, do you know why this has happened? Is this something that you can trace back to an activity that you've been engaging in, maybe having a lot of fun, or maybe, riding that bike, that extra 10 or 20 miles really was difficult? So did the pain come on after an activity? And if it did, one of the first things that you can do is get an ice pack and put it on the area. Now, when you use an ice pack, you want to make sure you cover it in something really thin like a pillowcase or even a paper towel. Don't put an ice pack or even, some frozen vegetables directly on your vulva and your vagina because it can burn the skin. So make sure you have some kind of thin cloth barrier like paper towel or pillowcase to protect your skin. When you put the ice pack on, make sure you sit down and put your legs up. That way you can decrease some of the inflammation. You might also try taking some Tylenol, some Aleve, or some Advil. Now, the other thing that you might consider is using a cool bath. Don't put hot water on the area. Hot water will just increase the blood flow and make the pain even worse. So try a little bit of cool water, like a cool bath, if that's possible. So then the next thing to do is to see how you feel in about an hour. Most of the time, this will get better in an hour or two. But if it doesn't get better and it's getting worse, then let's do some more research. Do you feel something there? Do you feel like there's a lump or a bump or something even that feels like a large golf ball or like a pea-sized lump there? If you're feeling a lump or a bump, then think about getting a mirror out and taking a look. Sometimes there are small lumps or round bumps in the labia. Those are the lips that surround the vaginal opening. And it depends on what size it is and what the color is. So if you see something that looks round, like a small golf ball or like a grape, and it's got a little bit of redness, if it's warm to the touch, that means it might be infected, and that's when you want to see a healthcare provider. Now, if you see something that's not inside the labia, but maybe on the outside between the labia and your thighs, and it looks like it's close to the hair or where hair might have grown if you've had some waxing done or some hair removal, then it may be an infected hair follicle or something called a sebaceous cyst. So a sebaceous cyst is where a sweat gland doesn't have an ability to have all the sweat come out. Maybe there's some skin that grew over the opening, but that sweat still gets produced. It just doesn't have any place to go. So the skin will make a small ball or a little lump or kind of like a pimple. If that's happening, then you can use some warm water. You'll want to gently squeeze that area a little bit like this. And that's sometimes like popping a pimple. It'll sometimes help some of that, whatever's in there, come out. But if you have a large golf ball sized lump in the labia, any amount of squeezing is not going to make that go away. Sometimes when you have those kind of lumps that are really large and it's hard to walk, that's when you need to see a healthcare provider. Oftentimes it's something called a Bartholin cyst. And a Bartholin cyst is coming off of the Bartholin glands. There's a set of glands on either side of the vaginal opening called the Bartholin glands. And sometimes the opening to that gland also there's skin that grows over it, and there's nowhere for those secretions to go. So it just gets larger and larger and larger. I've had patients come in with a large Bartholin gland, again about the size of a golf ball, and it was really hard for them to walk. Sometimes we can treat these just with warm soaks, some antibiotics, and sometimes they have to be drained surgically, but that can be done right in a healthcare provider office. So I don't want you to worry or wait for that to go away. If you have something like a little golf ball size lump in your vulva, then do see your healthcare provider. So when it comes to vaginal pain, sometimes right at the opening, and when we think about the opening to the vagina, I'll put my hand here, right about here at about 6 o'clock, right at the very bottom, right before it goes down to the rectal area. This is what we call the introitus, or the vaginal opening, but at 6 o'clock it can get really tender, and you can get small micro tears there. If that's happened because you've been having sex maybe before you were ready, before you were aroused, and maybe you thought, oh, I'll just do it this time without lubricant, that's okay, but next time use a lubricant. But sometimes what happens is that very delicate skin, it will tear, it will spread apart. That can be very, very uncomfortable. If you're having vaginal pain from intercourse, what will happen is if you have a tear in the skin, initially it will burn, and then if soap touches it, or even when you're taking a shower, or even when you wipe, if urine touches it, you'll feel a burning sensation. And then later on, as the skin heals, it will start to feel a little itchy as that skin kind of knits back together. So if you're having pain with sex and you feel like things tore a little bit, give yourself about 3 to 5 days before you engage in any kind of penetrative activity again, so that very, very delicate skin can heal. When it comes to vaginal pain, oftentimes there's an infection involved. So if you're also noticing some itching, some burning, or maybe an odor, that's the time to talk to your healthcare provider. Oftentimes when we have vaginal pain, we just automatically assume that it's a yeast infection, and we go off to the pharmacy or the drugstore, we get anything that we see that says vagina on it, and it may or may not be the right medication. So if you are having itching and you think, oh, this could be a yeast infection, you can try one of the over-the-counter creams, but if it doesn't get better in about 7 days, do contact your healthcare provider, because there are medications that can be taken by mouth that will make this go away much faster. So I hope this helps answer your questions about vaginal pain. And as always, if you need more information, you can go to my blog, nursebarb.com. So take care and be well.